Hi, everyone, and welcome to another episode of Psychology for Growth. My name is Richard Amaral. I'm a psychologist here in Ontario. But without further ado, I want to introduce my friend Nicole Gillis Copling. We haven't spoken in years. We used to work together back at the Calgary Counseling Center back in the day. Nicole, it is so good to see you. And I got to say, I love the shirt. I love that t shirt.
I
Yeah.
know, right? Well, this is a good platform for the shirt.
Yeah, it is. Absolutely. Absolutely. Empathy. I
Yeah.
talk about empathy as like being one of the most important qualities or skills that we need to build relationships. So, Nicole, that's a great
Yes.
segue into what I'd like to talk more about. Relationships. I had Derek on a couple weeks ago, and we were talking about just relationships and conflict, men's mental health. And there were a few things that he mentioned that I really would love you to follow up on and get into a little more in depth. But it had to do with things such as emotions in the body, and just as a way of like how do we, I guess, resolve some conflict, especially when an individual has experienced a lot of trauma in their past. They get into a relationship, there's conflict, and the trauma sort of impacts the way they relate to others. So I just want to know if perhaps you can talk about that, just sort of trauma in relationships and some of the work you're doing in that area.
Sounds good. First of all, yeah, thanks for having me on, and it's very exciting to
Yeah,
see Richard. We go way back. So yeah, very cool to sit and share some info. I will just note I
absolutely.
also know Derek, so
Hmm.
your last
Yeah, which makes
presenter,
it all the better.
and yeah, so it's kind of exciting. Yeah, so I think diving into this topic, it's sort of a wide one. I think in terms of the things that come up for me for trauma is, the word, it's like trauma and then it's like impact, right?
Mm,
Um, so I do see a lot of, I guess about a little bit about me is what you wanted. So I guess just in terms of my umbrella, it's sort of wide. I'm a family counselor. My specialties are sort of two specialties. One is children and teens, and the other one is trauma in general. And within that, right, you work with individuals and couples and all of that. So work with lots of different people of different ages, stages of life, all of it. And I like to keep that mix going.
mm,
So yeah, I think in terms of if we're just looking at trauma, it's interesting because we're also looking at a lot around regulation as well, is
right.
sort of the word. So to go back to me now, you want to talk about regulation. So
Yeah,
I
yeah,
have
absolutely.
triplet boys who
That's
are almost 13. So it is interesting when you do a lot of family work and work with parents. It does come in handy to talk a little bit about, well, like, how do you balance your life and being a good role
yeah.
model for that. Yeah. So I think some of the tips and tools, and then we can get into a little bit more around the work part of it, is just trying to be sort of, I use the word anchored as much as possible. Anchored in, grounded. Um, you know, it's like managing your stuff so that you're in your thinking brain so you can help the others, the kids, manage their stuff,
Hmm.
right?
Yeah, like
So
yeah, just sort of anchoring yourself, being present. Is this sort of like mindfulness is, the
totally.
term that a lot of yeah. Yeah, yeah,
Yeah,
yeah.
so much around mindfulness. I use that a lot. And sometimes I think mindfulness gets a bad rap as a fluffy word. But boy, if you look at what mindfulness actually is, I like to explain it to clients as, look, stage one, it's really awareness. It's a hyper awareness. If
Mm,
you're doing that, you are thinking mindfully. So that's actually what mindfulness is. And then, of course, you dive a little deeper into more about it and continue on with it. So I kind of see it as awareness, mindfulness, and then all the way up to like sort of meditation.
got it.
I think people get a little scared of that word meditation, like, ooh, that's big time. I
Yeah,
don't know
yeah.
how to meditate. I can't focus for more than 20 seconds. You want me to meditate? But the progression of, well, can you be aware for a second? And you start there.
Yeah,
And like Derek was saying, your last presenter, in the body. It
yeah.
starts in the body. So much around children's work and trauma work is in the body. And what does that mean? And I think that a lot of people just in general don't understand how what regulation really is, and like everybody's dysregulated.
Mm.
So that'd be a good piece to kind of talk a little bit more about. Um,
Sure. So I'm
yeah,
curious then about that. Yeah, when you said everyone is like dysregulated, yeah, absolutely, especially um since COVID. I
yeah,
find that
for sure.
like it's just a lot of people just the impact it had on our mental health, a lot of isolation, and I think it was, we talked about trauma. I think it was a traumatic experience for so many people. But
Absolutely.
this piece around the regulation and children then, how is that different? Because I can appreciate being mindful as an adult, right? But with children who are so much more hyperactive, lots of energy, they go through a temper tantrum because you tell them it's time for bed.
Right.
What are some tips around that, around
Yeah.
like the regulation, how you can teach a child to be a little more mindful?
Yeah, absolutely, for sure. It's funny. I find that the one of the biggest factors with kids that gets missed a lot of times is language and the
Mm,
words we choose and how we talk to them, but also teaching them more around like sometimes, and we all fall into this, myself included, like we miss the validation step, and not just with kids, like with partners and with everybody. So the validation is if a kid comes to you and said, I had a really bad day and this happened, and then maybe they did something that you thought, ooh, that wasn't great. And you go right to the problem solving thing. So we go, oh, well, like, you shouldn't be doing that because of this, and next time. So you can do that as a parent, but just wait.
mm,
Do it, shelve it, know it's there, like it's coming up as a, ooh, there's something I need to teach here. Like that's not right. But if you stop and pause and do the validation piece, that actually has a lot to do with regulation. So what I mean by that is saying, oh wow, sounds like you had a very big day. That sounds busy. Sounds a little overwhelming, dude. Like, are you okay? Or another great one for kids that nobody uses with kids, because let's just be honest, we don't really want to sit around for it, but we need to. So, is there more? What parent says,
more.
is there more, honey? Right?
Right.
We want to just shut her down so we don't have to hear all the emotional stuff because it's uncomfortable for us.
Yeah.
It's like a lot to be around. But if you give these cues and do these things, they will regulate fairly quickly unless,
Mm,
you're dealing with other things. There's lots of things to consider with kids. There's lots of issues. There's developmental issues. There's kids that have different types of disabilities or needs that need to be met. But if we're taking a regular situation that I'm just giving an example of, um, once you say like, huh, wow, it's that thing. I've been seen, I've been heard. And then they listen to you because they're good to go. But we shut them down all the time. We do shutdowns all the time. We don't even really know it. And a lot of
mm,
times we're shutting down because we're uncomfortable.
mm.
And that's the cue that I see with parents go, tell me more about that. What do you mean? It's like, well, kid's having a temper tantrum. How's that feel? Like, get me out of here. And it's sometimes a sensory overload. It's like for us. So we try to shut it down. So what we want to learn is like validate that's hard. So as a parent, if you have a moment where you can just be like, okay, this feels really uncomfortable. I'm gonna breathe. I'm gonna know like they're here. I'm here. If you can cue yourself in your head and start to do the work of like, okay, this feels uncomfortable in my chest. I'm gonna breathe through and I'm gonna stay. I'm not on fire. We feel like we're on fire in our body. It's
Yeah.
not as urgent as you think. It feels so urgent and scary, but the thinking brain, it's not. So you have a minute. And whatever you do, you're a barometer for them. So if you regulate a little bit and slow down, they'll regulate and slow down typically, or you'll get there. So that's the thing about how do you teach kids mindfulness is you role model it and it's a language. So validating first, and then you get to the teaching part after, and the directing part. Um, but language is important
Mm,
for sure, which we could give more examples of. So it's like the analogy of like you want to um, help yourself first in order to help them. So manage yourself and then help them manage themselves, not manage them. Does that make
right.
sense?
Yeah, absolutely. Yeah,
And before you jump in, I just want to end that with a really good analogy or metaphor for it is when you get on the airplane, oxygen mask drops. Take it for yourself first and then you assist others. So that's a nice little visual to have to try to keep you on track in your brain because this stuff's hard.
Yeah. Yeah, no, I like that. Well, I was just thinking of your T-shirt, and when you talked about that intervention with the child, because that
Mm.
validation really is one of the steps of empathy, right? Let the
Yeah,
child know, oh wow, you got a lot of big feelings. We've been using that with our kids. It's like it
yeah,
sounds like I got a lot of big feelings around this, and then similarly, oh, it sounds like you got a really big day. But I like the follow
yeah,
up of the tell me more, so now you're giving
yeah,
the child an opportunity to talk. And I could see how just the act of talking,
yeah.
they feel heard, and that probably physiologically calms them down a
Yes.
bit more
Right away.
right
How
away.
many times are they feeling heard? Maybe with their
Yeah,
friends sometimes.
yeah,
Teachers don't have time. I mean, bless them. They do their best and sometimes they do and they have their moments, but there is so much to manage. Parents are busy, but we don't think about it because we probably really didn't get that model growing up either.
right.
But, it doesn't actually have to take a long time. It's not necessarily it's not the quantity, it's the quality. It
Yeah.
takes a minute. And it's just the understandings. I mean, the physiology of the body is so important. One of the other things I like to, when I work with clients, whether they're 7 or 70, a little psychoeducation, like a little
Mm,
educational pieces. I find people get a lot out of that because what it does is that's validating. So things about how does the body work then? So just so people know, like in your brain, your brain can't be in two places at one time. Your brain can't be in the emotional part of your brain and the thinking brain at the same time. So that's really important to just note for a second. That's
mm,
why nobody's ever really proud of what they do when they're angry. It comes
yeah.
back to, well, maybe one 8-year-old once was proud of himself, but that's it. That's all I can remember. Right?
Yeah.
But it's like, nobody's online. You're offline. Your thinking brain is not the one that you're activating when you're triggered and when you're dysregulated. So think about it as, oh, I just have to get back to my thinking brain. The only thing you do then is like very little. It's just breath, breathe, and talk to yourself like, okay. Like I was saying, like, I'm not on fire. It's not as urgent as I think.
Mm,
It's a little weird to think about acknowledging feelings and knowing what they are, but then saying, well, they're kind of not real. Like they are real, of course, but they're not, they're distorted, right? Emotions are also distorted. And so we think like, but like if we breathe and stop and flood back to our thinking brain, we're like, we can get through this.
yeah.
And that's what
Yeah.
you have to just impart on kids and help them with it and just give it a second or just say, look, I see what's going on for you. You seem really frustrated. This is hard. I'm going to give you a minute. I'm going to be right here. I'm going to give you some space. We'll come back to it. Like, that's it. I'll come back, give you a minute when you're ready. And even if they're telling you off, just know their intentions aren't to piss you off. A dysregulated kid is a little wild. They aren't trying to be disrespectful. It's
Mm,
just the spouting off, right?
mm,
And by the way, Richard, I just wanted to make a quick comment about when you said like we said like you've got some big feelings there. Great with school age kids. Never use that on a teenager.
mm,
You got
right.
some big
Right.
feelings there, right? It's like, hey, I see that seems pretty overwhelming for you right now. Like we want to be respectful and age appropriate, or it's just a big backfire.
Yeah, that's a good point, right? Is
Yeah,
just communicating in a
yeah,
way that is also respectful that they'll understand. Um,
yeah,
excuse me. So one of the things I guess was just that emphasis on the like even going to the thinking brain, right? We're gonna approach this rationally.
yeah,
But even before that, it's about calming the body. Actually, I was just having this conversation with a colleague about if we were to think of sort of this next wave of therapy, of counseling, I really think it's going to be a lot more focused on the soma, on the body, especially with what we've learned about the brain and the impact on behavior, just really getting very specific about the areas in the brain that are responsible for certain behaviors and emotions. A lot of great research has come out of that in the last, 15, 20 years. But for a while there was like the cognitive therapy revolution where how can we change our thinking and let the
right.
thinking guide our behavior or our bodies. But what I'm hearing you say and what I've heard for the last couple interviews is like, actually, let's calm the body first. and then we can engage in this rational thinking. Um, on that note,
Hmm.
we're talking about the parent, and I love the bits you were giving about the children. But how about for parents now who are traumatized, where perhaps their tolerance for a child's
Hmm.
tantrum, for their teenager's behavior, someone who's been traumatized, like it, and are often very hypersensitive, hypervigilant, it might be a little
Hmm.
bit more difficult to reconnect with that body. Again, it's about regulation. So could you talk about that and
Mm.
regulating, for parents who've been traumatized and
Yeah.
their
Yeah,
responsibility?
that's huge, right? And
Yeah.
even just I'll just say I'll start with like again, trauma's on a big continuum, and there's little t traumas, big T traumas, and like those are
Mm,
just more complicated or single incident, and there's emotional trauma from growing up. But with that said, you know, I don't want to overuse and misstate the word trauma, but it's like when you get in a really difficult situation with a kid and there hasn't been necessarily trauma, it feels a little emotionally traumatic at the time as well. So
yeah.
it's this continuum. So yeah, I don't think I can even answer that question without talking a little bit of the biology of the body. So when we talk about cognitive behavioral therapy and trauma work, and you're like the somatic work, the body, you can't, I believe, and I mean, I think all the experts in trauma research and teachings would say you can't really do trauma work without the body, because trauma lands in, it's stored in the body in the non-language part of the brain. So then how are
Mm,
you accessing and clearing and processing through trauma with just talk therapy? So the
right.
risk you run, I like to actually, when I do work with trauma, the model we use, I do the EMDR model, which I
Mhm.
can explain or some people might know. But I interweave cognitive behavioral therapy with everything. I don't think it's ever not there.
Yeah.
That's the science of it. Cognitive behavioral therapy is making the links and connecting the dots within EMDR as you go. And
Mm,
I find that two of those are very productive. So working with the body, um, and just knowing that if you're talking about trauma or you're dealing with trauma and it's just talk therapy, at the beginning, that's okay. It's a bit about processing. Processing is important, but just a note that if you're just doing talk therapy, you can actually re-traumatize people because now they're just
right.
retelling the story and re-experiencing it. That's not great. So that's the point where it's like you need to go process it. So that's where it's in the body and we're going to move it along. It's like going from the long-term memory. Things get stored for reasons to protect us, and we have to bring it back into the working memory. And so there's a model that does that quite safely and effectively and productively, and that's EMDR.
Mm,
So it's the science of like, why do we have to be in the body, and what do we need what's all this body talk about, somatic talk? We can't access stuff and deal with it and clear it and get you untriggered without talking about the body. So for someone who's been traumatized or an adult that's been traumatized, dealing with kids, it is very difficult because we have these gaps and blind spots for a reason. They're there to protect us. So a quick example, which will help understand this, is like, let's say you're in a motor vehicle accident and you got hit by a red truck. You're okay, but it was a serious enough accident. So when that happens, we're not processing the accident. We're surviving through it.
mm,
It's the fight, flight, freeze. It's amazing. It's there to numb us out and protect us so we don't feel it all. So when you're going through that, what happens is different areas like the hippocampus gets suppressed, for example, in the brain, our orientating systems, everything gets kind of stored. So then the double-edged sword is you think, okay, I'm okay. I've talked this through. Thank goodness I'm safe. 3 months later, 6 months later, 4 weeks later, driving along just some random road and a red truck's coming towards you, and all of a
mm,
sudden your heart rate spikes and you pull over and you're like, what's happening? So the body, I think it's Bessel van der Kolk would say, like, body keeps the score, right?
yeah.
Body runs the show. All the trauma books, it's the body. So understanding that, like, if you don't work with the body, you're going to be a little bit lost, right? So that's where we have to start with a parent or a person that's trying to keep themselves regulated is if you have some science to this, it feels like you can have so much more control. You got a tool belt now. It's like if you don't stop and breathe, the trigger will take over and you will
Mm,
yell and you will weep or you will punch a wall. So it's like What is this? Oh, I know what this is. This isn't my fault. This is how the body works. This is okay. I'm not abnormal. This isn't weird. This is a structure. I know it now and I know what to do. That's what's so important for people to understand because it also takes away the shame factor. There's a
Mm.
lot of shame in trauma. Um, right?
Lots of shame.
I think so.
Yeah.
Yeah.
Do you work specifically in that area of shame? And
You can't I think it's Brene Brown who's good job,
yeah,
Brene. Little
yeah, yeah,
plug, like outed shame in terms of nobody's talking about shame enough. If you
yeah.
listen to Brene Brown, therapists aren't talking about shame enough. And she said a long time ago. And honestly, I've been doing trauma work for a long time. And I can promise you, no matter what people come in for, it's a wide variety. Shame is one of the roots.
That makes so much sense. I hadn't thought about it. Sometimes I'll get emails, for webinars or for trainings on the topic of
Yeah.
shame, and I honestly, brush it off mostly because there's so many other topics, other areas of development and professional development that I want to focus on. But until this point, it makes a lot of sense. Is that shame associated with trauma, right? Because when
Huge.
something happens to us, something traumatic, and if 6 months later we are still getting triggered by any cue associated with that traumatic stimulus, whatever, that there is a sense of like shame and maybe embarrassment. And it's like, oh my gosh, I
Right.
should get over this, and why am I still bothered by it? What is wrong with me? So I hadn't put that piece of the shame with trauma till now. So thank you for that. Okay, it makes a lot of sense.
Can I add a
Yeah,
bit
yeah.
about the shame piece? I
Yeah,
think that
yeah,
will help.
please do.
Um,
Please do.
Peter Levine, you can look him
Mm,
up. One of the pioneers of like the trauma and the somatic work, the body. If you look up some of his work, there's some very, very fascinating information there about shame in the body if you really want to understand it. And he will talk about, he works very methodically and gently and slowly and at the right pace with people that like, he talks about just like a shame posture. People can get
mm,
stuck and frozen in a shame posture and just bringing them out and just gently making them aware of like, oh, if we were to slowly like just move up your shoulders, like
yeah.
it's like arrive in the room, like what shame can just hijack people because they have a shame mindset. It's my fault or this happened, I'm broken. And if you've had emotional trauma and again, I'm remembering your what you and Derek were talking about
Yeah.
is, and I have a quote for it, be careful what you say to your children because it's what they'll say to themselves.
Mm,
So if you're raised with parents that are like, you're worth nothing, you're no good, so you sit in that shame posture. How do you step out and do something good? That's
yeah.
what's inside. So when you give them the science of it all and some explanations, then they can say, "Oh, wait a minute." So this is narrative therapy. You're externalizing the problem. You're not the problem. The problem is a problem. We're using it in cognitive behavioral therapy. Did you know? If you say this to yourself, you'll feel bad.
Yeah.
Every model can be done with shame. We want to out it. This is not on you. This isn't your fault. This happened because of this. And this is how the body responds. And then people are like, what? Say that again. Or no one's ever said that to me before.
Hmm. Yeah.
Yeah. So
Was it?
important.
It is. It is. I mean, like, it might be metaphorically, but literally having this weight off our shoulders. This is
Yeah.
exactly what you're talking about. They'll come to therapy and they'll vent for a bit or the process a particular event.
Hmm.
And they'll say, "Oh, I feel like I just unloaded. I got this weight off my shoulders." And I was just thinking about that soma, right? And just
Yeah.
literally, like, just the shoulders being weighed down because of all this heavy emotional stuff a person is carrying for decades,
Hmm.
oftentimes.
Yeah.
Um, so they come in, they're working with you, you're doing a variety of interventions, but I also know in my work with trauma is I want them to feel safe. So I was
Mm,
wondering,
huge.
Nicole, yeah, like, could you talk
Yeah.
about that in terms of like emotional
Yeah.
safety? How can I, because that was the other thing that came up in my interview with Derek, right, is we create
Great.
this space in our relationships where we can, if there's a conflict, I'm mad, you're mad, or both want to, or angry with each other, but at the same time, I want us to feel safe so we can talk about and work through our issues. How do you deal with that in the therapist's office?
Yeah, I think with trauma work too, like, when I said the model of EMDR, which is eye movement desensitization reprocessing, which you're really like helping people process through trauma, just a structured way to do that, of course.
Hmm.
We have to also remember, like, there's some times where you don't want to use that model, and people need to have the foundation first. It's triggering. So that's a huge thing around emotional safety is you want to make sure like they have their basic level of functioning before you launch into something that you're kind of opening a can of worms.
Yeah.
So always looking at safety. Is this a good time for this person? Can they handle a little bit of processing around this? So that's really knowing like how are they managing those sorts of things. But also if you are processing trauma with someone, always gauging it. It's like a volume dial, old style volume dial that the young kids don't know about. 0 to
Yeah.
10, it's a little dial. But it's like, if you're doing something with trauma work and you were on, like, if you talk about dissociation, you have to watch, engage with your client very closely, like be very attuned to like, are we stopping now? In their window of tolerance for everything, kids, trauma work, people in general. So what I mean is, is it too much? We don't want to just let's keep it going. Let's keep it moving. Well, hold on. Because if you're not in window of tolerance, then you're probably or possibly doing some damage. So that's stopping, slowing down, checking in, and seeing is someone checking out? And how
Mm.
do you know? The nervous system, you need to be, Derek talked about the parasympathetic nervous system, sympathetic, parasympathetic nervous system. You need to be in sort of like the green zone in the nervous system. Um, when you're doing EMDR work, it's keeping you regulated, but you have to watch for those things. Are we pushing people too far? Do we need to stop? Do we need to check in? And I'll ask people like, tell me more. It's funny, like therapists will say that. I won't say that. I don't ever because they're just so trauma trained and there's little ones here that will just do it. How do you know if they should tell you more? I say,
Right.
is it should we talk more? Is it okay to talk more about that? Should we table that? Or like I'll always check, it's checking in.
Got
Should we
it.
talk about that? Is that something we should leave? Or I'm not sure about this one. How does it feel?
Yeah.
Is this too much?
Yeah, you know, we were talking about you're talking about in the context of working with clients in our office. I was thinking about it as well in the context of parenting. You know, where
Yeah.
the child has experienced a traumatic event, and or you think they're going through either a single
Yeah.
event or just something dealing with that school bullying whatnot, but I like that checking in. That's pretty much what it is, like, hey,
Mm,
what happened, are you okay? And as they start talking, just being mindful and saying, are you okay to continue to talk, because I'm really interested in listening
right.
more. um yeah, so just that checking in, and that helps a
Hmm.
person feel safe to process and to move forward. Cool.
Yeah, and one thing
Yeah.
I'll add for the parenting piece is we talked about so the window of tolerance. I'll come back to that. It's really
Yeah.
around so Bruce Perry, who is very much a pioneer. He's a neuroscientist and a psychiatrist. I'm sure lots of people know about him. Um, he has a it's an infograph. It's the 3 R's to regulation.
3 R's.
So what happens lots of times is you want to regulate like yourself, the oxygen mask, yourself, and help the child to regulate, then relate,
Mm,
then reason. But
mm.
people don't have a manual for this, and you're doing your best as a parent. And lots of times, and people will know as soon as I say it, we're going straight to reasoning with our kids. And then they're like checked out. They're just done. They're
Yeah.
either screaming or they're not listening. The teens like blocked you out. So what that example of that is just like, okay, do we need to stop feeling like we just take a minute? Can we come back to it? And when you come back to it, don't just start the directing and reasoning. Just do something where you're relating. Like, I realized when I took a second that, it's really hard. It was hard for me too. And I think it was hard for you. And, or if it's a touchy kid and it's okay to touch, it's just like a little something. And now you're with them. They feel seen. They feel like they're going to be heard. So now they're okay, they're feeling better, you've related to them in some measure. And then you can say, like, let's talk about like what happened or what could we do differently next time or what do you think went on for you? Now you can start reasoning. But it
Yeah.
really is a waste of time to go from that to that, whether it's a partner or not. And with couples, it's kind of the same thing. Right?
Tell me about that. Tell me about that couple piece and the
Yeah,
three
like
R's as it
I like
applies to that.
okay. So I think how this, relates to couples is, there's this pattern sometimes we refer to in counseling, the counseling world, where couples sometimes get into a pattern of pursue withdraw. So
Mm,
someone's overwhelmed. It's too much. They need to stop. But the other person just feels very like that urgency in their body. So remember how I was saying, it's distorted. It's a distortion. Like you do have time, but your body
yeah,
doesn't feel like it has time. It feels very uncomfortable. You want to get it solved. You want to get it dealt with. Don't walk away. Don't leave me. Let's finish this, right? So that piece is very much around managing that too. So if we can somehow in there say, oh, like the right language is important for the other person to go, look, like I can come back to this. I promise. This is right now. If we stop and get back to our brain, like thinking brain. So if you can stop in there and regulate, calm down, right? Um, and using validation if you can get there, like, okay, so I hear you, but we can't go on right now. We need to break. We need to stop, right? So that's the piece too around with adults and couples is how do we help each other? It almost feels like it's easier to just land when you talk about kids. "Oh, I should be doing that with my kid, but with the
right.
partner, it's like, what's their need, right?
Yeah,
But if
yeah,
you're
yeah,
always thinking about what could you do that's going to be more helpful for them in that moment, it's like, can you get in their shoes and figure out, oh, this isn't actually about me. They need a second. Don't take it personally. It's not about you. They need a second. So you can offer them that, but
yeah.
you have to talk to yourself first. Another thing that trauma counselors and researchers and like again, the pioneers of the field, what they'll tell therapists in the trainings is help your clients to get their brains to talk to their bodies. You want to tell your clients, talk to your body. So right now, you're feeling overwhelmed. This feels awful. Take a second. You have a second. It's not urgent. Stop, breathe,
I like that. Just
right?
that
Because
pause.
yeah, because otherwise it's we know it's off and go. And then you know what? You spend time in regret and trying to make up for it. Wouldn't it be nice if you could just stop and do nothing? And you don't have to do that recovery,
Yeah,
right?
yeah,
Just let's just
yeah,
not do anything. So,
yeah,
it's funny. I did one of the presentations I did last year, or whatever it was. It was sort of funny, but it was like when it comes to this stuff around when you're having a good day with kids and when you're with your own kids and when you're not having a good day with your kids, it's like on a good day, we're rolling out all the textbook stuff I know. So great, good job. Validation on the bad days. It's do the least amount of damage.
yeah,
That's it.
yeah.
Least
That's
amount of
keeping
damage.
it simple. That's it. Yeah, yeah,
Yeah,
yeah, yeah. Just
yeah.
keep them alive. Don't do any damage. Yeah, yeah. Watch what you say and using
Yeah.
yourself as the barometer. I like that. I
And
like that.
do you see how this is all really, this is awareness. Be aware, manage what's going on. It's mindfulness. How you talk to yourself mindfully. It's like you can do this. You're okay. You'll get there. Not like this is ridiculous. I can't handle this, right?
Yeah,
I assure you, whatever you tell your brain, whatever your brain tells your body, it will do. So if you say you can't do this, it's out of control, you'll run around. If you tell your body you're okay, take a second, it'll go just like Derek said, right?
yeah, yeah,
So,
yeah.
and there's
That's
one more concept. We'll just talk about that. There's one more concept I want to make
yeah.
sure I say, but yeah, any reflection on that?
Yeah, no, I was just gonna actually, I was thinking of working with a couple of adolescents around test anxiety. And,
Mm,
just how their brain just starts racing with all these negative thoughts and sometimes shame, perhaps, about, I can't do this. This is too hard. But really, if we just tell our bodies, no, calm down. We can do this. We're just going to take a breath, just going to take a minute. Suddenly that pause changes our outlook on everything, right? And it
mm-hmm,
changes the way we continue on with that test or whatever task we're doing, whether we're an athlete, and some sports psychology there. It's like your brain
mm-hmm.
telling your body, no, we can do this. We've done it before. We're going to do our best. We can do this. Yeah, but just that self-talk and what I like what you said about the brain will tell the body what to do. That's good.
And then you do it. Let's
Yeah.
take a step. It's not like, well, I'll see, I'll try to go, make that lunch. I'll get there. It's like, no, I'm gonna actually go make the lunch. Like steps to the kitchen, or like, yeah,
Yeah.
I can see
Yeah.
myself having a shower soon. I'll get there, but you're
Yeah.
scrolling. No, no, no. It's like I'm now walking to the shower,
Yeah.
right?
Yeah. Yeah. You
It's
just got to get
simple, but
specific. Yeah.
important.
Yeah.
And the thing about you were saying about kids, so there's just such a wide net of stuff we could talk about around helping kids with that kind of stuff. But remember, like with kids that have like learning disabilities or delays around some things or sensory issues, is you have to break it down in chunks. So,
Mm,
yeah, let's not look at like the end result yet. That's overwhelming. We are not there.
mm,
Let's cover that sheet. We're not looking at that. We're doing this. Let's just manage what's right in front of us. So, I think after, right, you have that breath and have the calm. Let's just see if we can do this one step. Let's just
mm.
this one step and see where we get to from there. Um, right? That's
Yeah.
it. And then
Yeah.
after that, we do the next. And also another really great thing to think about is it's really around, this is another whole thing around growth mindset. We could do another presentation on this
Yeah.
versus fixed mindset. So
Yeah.
kids have
Carol
fixed
Dweck, right?
mindsets.
Dweck.
Wow, I think yeah, and
Yeah. Yeah.
there's so much out there on that, such
Great
great
book.
stuff.
Great concepts.
Yeah. And there's lots of material on growth mindset and fixed mindset. So what you were saying in your example was the fixed mindset. I can't do this. This
Mm,
is what. But the growth mindset is if a kid says, an example, well, I can't do this. I couldn't do it last time. I can't get it this time. And I just didn't get it right. It's like, well, we're not there yet. Like I can't. Well, not yet. But let's try this. We're gonna give this one again. But it's like it's not like no, no, stop. Let's do it again. This idea that like we can try again and it's just a little more gentle.
yeah. Nicole, this
Yeah.
was fantastic. So we've been talking about parenting, we've been talking about
Hmm.
some of our work with clients. So now let's read it back to you. My book is all about balance, right? Living a more balanced
Yeah.
life. And you're being a mom with triplets, you're a professional, you manage a big caseload, doing a whole bunch of different things professionally and personally. So I just want to know, how do you keep balanced? How do you stay balanced with this kind of work you do and being a mom, and how do you
Yeah,
manage
for sure. I think it's actually kind of comedy, really.
it?
It's like I think the state of overwhelmment, like you have multiples, it's a multiples thing.
Yeah.
Everything's all at once.
Yeah.
And ironically, I kind of have a bit of a sensory issue, so the universe gave me triplets, quite hilarious, all boys. So,
Nice.
been a growth. It's been a growth around that feeling of like the overwhelm, like I'm on fire, like everybody needs a piece of me. So
Mm.
self-caring for everyone all the time.
Mhm.
And I think, honestly, the things that keep me sane are I think, simple things, but urgent things. So just a little bit of self care. So that's like whatever that is for someone, whether that's bubble baths every second night. I like my lattes. I book my massages no matter what. And then I don't feel guilty about it. I tell myself,
Mhm.
you're doing a good job. Self talk, you're doing a good job. You're doing the best you can. That's huge. That keeps me going.
Mm.
It's like, what are the facts? Facts are you're doing your best.
Mm.
Um, and you try to recover when you don't. Recovery. So it's actually stuff I'm telling myself in my head is mostly what helps me because when you have that sensory overload, you always have to be talking to your body about just, you're okay, like just keep going. So the self talk, gentle talk, validating yourself.
Yeah.
Gotta validate yourself first. You're not gonna validate your kids or your
Yeah.
partner. And then yeah, just those little pieces of scheduled self-care things and repeat are valuable.
Mm.
I'm a social person. I have to have my little social dates with my girlfriends or people in the field, and
Yeah.
then that energizes us. It gives us a debrief, you
Yeah.
know,
Yeah.
time and care. But most importantly, I've learned what's a boundary look like with my kids, for example. So for me, I'll get caught up on like trying to do too much all the time. So that's, you got to come back to, okay, what are you doing?
Yeah.
And it's like, just a second, gonna finish this task, then I'll get to you.
Got it.
Promise.
Yeah.
And another thing I think is really important that I try to do, maybe I don't do it enough, and this is a good one for the screen time use, us adults role modeling,
Yeah.
but I try to make it clear. if my kids want something from me or talking to me and I'm on my device, which is also my work phone,
Yeah.
emails, calls, I'll they'll say something. I'll stop, I'll look at them eye to eye and say, just a second, this is a work thing. I'm gonna finish this. It's not gonna take me long. I'm gonna put it down and then I'm gonna talk to you. So the messaging is, you're more important than this. You're important. I'm gonna validate that right now. I'm gonna finish this. I'm gonna talk to you. And if they keep talking, I'll be like, just a second. And I'll say, look, this conversation is more important than this, but I have to finish this and then I'm going to come back to you. So like, right? What do we do on
Yeah.
autopilot? We're like, yeah, okay, and then we're not like in tune, and then it's messaging. Messaging
Mhm.
helps our stress because
Mhm.
it calms everybody down.
Mhm.
So
Mhm.
kind of like self-care about me and my life, but also how I use the tools for myself. Um,
Yeah.
just keeping things so they don't go to overwhelm. It's like my number one thing. Like, how do I stay anchored? Right.
Yeah, the body.
So, yeah.
That's great. Yeah, I was just thinking of
Yeah.
it in the context of the acronym promise that I use in my book. So a couple things. One was, that messaging to yourself, was thinking about the
Hmm.
letter M, which means mental health, this boundary in your relationships with your children. I thought that was excellent, but also the letter O in the sense of the occupation. You're putting a boundary around work, like this is a
Mm,
message or this is an email I need to take care of now, but you're more important. My relationship with you is more important than this. Excuse me, I really like that. And yeah, the self care, the massages, yeah, and the lattes or whatnot,
100%.
just
That's
that
it.
time for yourself, that quiet time, taking care of the body. Ah, so important. It
Yeah.
helps with mental health and emotional health and with a
Yeah.
balanced life. Yeah, good for you.
It's funny
Nicole.
too. It's sort of humorous. One more quick
Yeah,
thing.
sure.
Humorous, like if it's like you're a couple and you've had these little kids and it's all hectic and chaotic and
Yeah,
like someone needs
yeah.
to go to the drugstore and both parents are like, "I'll go." No, I'm going. Whereas
I
before,
want
it's like, I'm not going to the drugstore, you go. It's like, oh no. And now, these moms are finding themselves up and down the aisle. It's like, oh,
uh,
it's so calm
it
here.
is.
I'm at the
Yeah.
drug. The things you appreciate as a parent. I'm at the grocery store by myself. This is heavenly.
Yeah, yeah. Oh, so true. So true.
Self-care.
Absolutely. Those little moments, quiet time can
Yeah,
really help reset. You're absolutely right.
yeah.
Nicole, this was fantastic. I really appreciate this. Everyone, I hope you enjoyed it too. If you subscribe to my YouTube channel and my newsletter, you'll get more of these tips in your email inbox. Until then, I hope today's tips, our conversation has helped with some self improvement, some personal healing, and some growth. Until next time, everyone, take care and thank you.